Two people get a hair transplant, one looks completely natural, the other doesn't. Here's why.
Well, this is the commonest and the biggest concern that every single patient has today. Doctor, will my hair transplant be obvious to other people who look at me?
How will it look natural? What is actually the meaning of natural? Yes, when you do a hair transplant, you're obviously expected to have much more or many more hair on your scalp, looking like it look much more denser. But if it looks obvious that you've done a procedure, or it looks obvious that as if your hairline looks straight, or any kind of way that you can actually tell that it's a transplant, then it's not a good sign. So naturally looking hair transplant should never be able to be detected. A naturally looking hair transplant should always seamlessly blend into your natural hair, and nobody should be able to tell that you actually done a procedure or a surgery.
So, how do some hair transplants look unnatural? Here are some reasons why.
And one of the biggest reasons, and the commonest reasons, is an improper design, especially with the hairline. If a hairline is made too low, if a hairline is made artificially, if it is made too snake, if it does not have any irregularities, or if it is made a bit too dense, it is not going to look natural. Now, last point what I said, if making a hairline too dense will actually make it look like a wig. So if I look up from the scalp, up towards the hair, there always has to be a zone where I can see through a little bit. I can see a little bit of the scalp. This is called the transition zone. If there is no transition zone and straight away it becomes very, very dark or very, very heavy or very, very unnatural, bends a hairline, it will actually make it look like a wig. Ignoring basic facial proportions or making a hairline look funny. So yes, if you see a male hairline, it should naturally have an M. And of course, it should have a V or a U-shaped hairline. What I mean is the corners should be slightly higher than the center. We call this as the mid-frontal point, and these are known as the temporofrontal points. In the female, this is at the same level or slightly lower, making the hairline rounder. But in the male, it is slightly higher, making it either like a U or deeper like a V. So if you are older age group, you may prefer a V. If you are a Caucasian with a long face, a V may look better. If you have very, very sharp features or a sharp jawline, a V may look better. But generally in round Indian faces, the U-shaped hairline looks very good. Now in most of the cases, people tend to make this hairline very straight or make it a opposite round, and that actually makes the hairline look funny or it actually feminizes it. So be very careful while designing the hairline. Also, over harvesting the number of grafts. Okay, putting too many grafts in the wrong place, not in the proper distribution, will make it look unnatural. So for example, like I already mentioned, if you have too dense a hairline and very scanty hair, it will actually look funny. It will not look like a natural hairline at all. And also, what makes it look natural is under direction design, taking care of the donor density available, the age and the profession of the patient. So what do I mean by that? A lot of patients you must have seen around you have their hair standing up like this after a transplant. The hair actually grow out at an angle just in front. It's around 15 degrees from the scalp. Okay, you can either comb it sideways, center, or spike it up. But the hair now grows this way. So if putting the hair in the improper direction and angle will always make it look very, very bad. I also want to think of the age. If I have a 25-year-old person and if I keep his hairline very high, he's actually going to look bald. Why? Vis-a-vis if I have somebody much older, is 70 years old or 65 years old, who's already showing signs of aging on his face, and if I make his hairline like a 20-year-old, it's obviously not going to look natural. So yes, you need to understand these factors, these parameters when you design a hairline. Also, take in mind the profession of the person. For example, I'm a doctor. I do not need a hairline what many actors or TV actors need when they're facing the camera. So if I'm making a hairline for a businessman or for a professional, I will have a different thought process. But if I give a similar kind of hairline, mainly to actors who face TV, who face high density cameras all the time, they will still not be happy about it because their profession demands the hairline to look something different. So yes, keep in mind all these factors while designing the hairline and while distributing the hair in the bald areas.
If you're looking at a very, very natural hairline, then definitely think of all the parameters that I mentioned earlier. Always choose your surgeon properly. Go to a qualified, board certified surgeon. Okay, ask for number of years of experience. Ask what are the qualifications, how many hair transplants to be done, is he registered to perform this procedure or not. The technicians do the designing and the implantation, or is it done by the surgeon? I know all these factors. So hence, if you're looking at natural hair transplant, do visit us, do find out more about this, and definitely comment below.